All right, so the last section that we're going to talk about is going to be control of reproduction. So we're going to start off with birth control methods. The most reliable method of birth control is going to be abstinence, or not having any sexual intercourse. This also has the benefit of preventing transmission of sexually transmitted diseases. It is also the only method that is, of course, 100% reliable. There are a couple of other methods that are reliable, but it just sort of depends. So, for example, the birth control pill is about 98% effective. In a given year, that means that in a given year, roughly 2% of sexually active women using this form of birth control might get pregnant. Just as a comparison, the withdrawal method is about only 75% effective. So contraceptives are any medications or devices that reduce the chance of pregnancy. Birth control pills are going to be the most effective form of contraception, but these can also be administered a number of different ways. So birth control pills can be taken in the form, of course, of a pill, but they can also be administered hormones through a patch applied to the skin, which would also shut down the pituitary production of both follicle-stimulating hormone and luteinizing hormone. In other words, it just prevents ovulation from occurring. There are a couple of other birth control methods. So, for example, an intrauterine device. Intrauterine devices, or IUDs, are just inserted directly into the uterus by a physician. This alters the environment of the uterus to reduce the possibility of fertilization. And if fertilization does occur, implantation cannot take place. So this does not prevent ovulation, but it does prevent fertilization or implantation of the embryo, of the fertilized embryo. Diaphragms are like soft latex cups with a flexible rim that's going to fit over the cervix. This could also be used with a spermicidal jelly or a cream, but it should be left in place after sex has already taken place. So at least 6 hours after sex has taken place, that diaphragm should remain in place. Male and female condoms offer protection against pregnancy, but they also offer protection against sexually transmitted diseases. So female condoms, so that would be like this one right here. It's a large polyurethane tube with a flexible ring that's going to fit onto the cervix. Male condoms, on the other hand, are typically latex sheets that fit over the erect penis. The semen will stay inside, doesn't enter the vagina, and also prevents contact between the male and female genitalia. There has also been the development of vaccines. There is a vaccine in development that immunizes women against HCG, which is the hormone necessary to maintain implantation of the embryo. Contraceptive implants can use synthetic progesterone to prevent ovulation. Contraceptive injections are usually available as progesterone only or as a combination of estrogen and progesterone. The length of time between injections can be up to a few months, so this can be a decent alternative for an individual who doesn't want to have to remember a daily pill. There's also emergency contraception. So you may have heard of the morning after pill. Morning after pills are medications that prevent pregnancy after unprotected intercourse. Some can be started up to 5 days after unprotected intercourse. Now, the morning after pill does not prevent ovulation. It doesn't prevent implantation, but what it does prevent is it prevents fertilization. Fertilization can take quite a while. It's not instantaneous with ejaculation. It takes quite a bit of time for that sperm to travel the distance to reach the egg. So the way that most emergency contraceptives work is by changing the chemistry of the egg itself to prevent fertilization from occurring. There are also surgical methods. Surgical methods tend to be pretty permanent. In the case of males, vasectomy is going to be required. This would be the cutting and sealing of the vas deferens from each of the testes. The amount of ejaculate will remain normal. Sperm make up such a very small percentage of the volume of semen. So the individual will still ejaculate as usual, will still produce the same amount of semen. There's just not going to be any sperm present. Testosterone is not affected at all. Testosterone production remains completely intact and unaffected by a vasectomy. Tubal ligation is the cutting and sealing of the uterine tubes, and can be quite a bit more drastic. So here is a vasectomy. It's simply the cutting of the vas deferens. All of the other glands that are responsible for making semen are perfectly intact and are still producing as much as ever. The only difference is that there is no sperm moving from the testes into the vas deferens. Tubal ligation would be the cutting of the oviducts. This again is going to just simply prevent an egg from going from the ovary through the fallopian tube and entering into the uterus. So those are birth control methods. There is, however, another thing that we want to discuss would be infertility. Infertility would be the failure of a couple to achieve pregnancy after 1 year of regular unprotected intercourse. Fertility rates are pretty high. Around 15% of all couples are infertile. This cause is pretty evenly distributed between male and females. The most frequent cause of infertility in males is a low sperm count and or a large proportion of abnormal sperm. This can be caused by things like a sedentary lifestyle, smoking, alcohol consumption. Those can all contribute to low or abnormal sperm counts. Body weight appears to be the most significant factor in causing female infertility. In overweight women, leptin levels are higher, which impacts gonadotropin-releasing hormone and follicle-stimulating hormones. There are also other causes of infertility. For example, uterine tubes can be blocked from pelvic inflammatory disease or endometriosis, which is the presence of uterine tissue outside of the uterus. The tissue will go through the normal uterine cycle and cause pain, but it makes it much more difficult to conceive. There are fertility drugs. You can give an individual gonadotropic hormones to help bring about that ovulation. So to compensate for infertility, like we said, there can be fertility treatments and drugs. There are also assisted reproductive technologies. Artificial insemination by a donor. In this case, sperm are going to be placed in the vagina by a physician. Sometimes individuals will use their partner's sperm, but sometimes they can use donor sperm. Intrauterine insemination, IUI. In this case, fertility drugs are given to stimulate those ovaries, and then the sperm will be placed in the uterus. The sperm can be sorted to result in male or female child. In vitro fertilization, IVF, in this case, conception occurs in the lab. So the egg and the sperm are going to fertilize in a laboratory setting. After 2 to 4 days, the embryos are then transferred into the uterus. If desired, the embryos can be tested for genetic diseases before implantation begins. There's intracytoplasmic sperm injection. In this case, the sperm is going to be injected into the egg directly. Gamete intrafallopian transfer. It's the same as IVF, except the eggs and the sperm are going to be placed in the uterine tubes immediately after they've been brought together. So there is no waiting 2 to 4 days for embryonic development in a petri dish. Finally, surrogate mothers. In this case, women can be contracted and paid to have babies. Sperm and eggs can be contributed by either parent or both parents. All right, so that's it for reproductive technologies. You should be able to list the major forms of birth control in order of effectiveness, explain why vasectomies and tubal ligations are permanent forms of birth control. And although we didn't really talk about it, so I'm not quite so worried about it. You should be familiar with what IVF is, but in terms of distinguishing between IVF and gift, I'm going to leave that one out in our list of goals for this chapter. Please let me know if you have any questions, comments, or concerns, and I'll be happy to go over anything.